All right, first and foremost, good morning, everyone. How's everyone? Are you wide awake? Have you had your tea, your coffee? All right. Okay. If you haven't yet, please wait 15 minutes. With that, the future of data is healthcare, not the other way around. When I asked ChatGPT what a emerging market, low data hospital or clinic looks like, this is what it gave me, which I think is right. This is a perfect way of thinking about where healthcare currently is. You have Excel files, you have a lot of time management issues, you have a lot of inventory, and you have a lot of manual files. And yet, you don't have any actionable data. You have all of these things, but unless things are digitized, as was mentioned yesterday, the idea of transforming the economy and making sure we're able to leverage the data, find insights, and do more, we're not there yet. And I think specifically in emerging markets, perhaps in Pakistan, you can go to the nice medical institutions and find in America what we call an R1 institution. But if you go to Balochistan or you go to smaller, less developed parts, you're going to have paper. And the real question is, how do we go from where we are to the next step? Let's think about diabetes, unfortunately. How many people here have or know someone who's been touched by diabetes? I'd say that's about 2/3 of the room. My grandfather died of diabetes, and because of that, my father became a diabetes expert. I'm very fortunate. He built the understanding, he wrote the textbook for how you take children with diabetes and give them a long, high quality of life. But today, there are 537 million people who have diabetes, and there's type 1 and type 2. Type 1 requires insulin. Their body doesn't produce what they require to live. And I say live because insulin is an essential medicine. You need it to live if you require it. So about 40% of all diabetics require this, and it's expensive. The average person that I've interviewed, and I've spoken with 100 people in Pakistan, they spend about 40% of their salary just to be able to cover the cost of insulin for themselves or for their relative. In America, it's a larger percentage, and it's rarely covered. The fact is, a small vial this large costs $2.82 to make. And yet, the average sales price globally is 10 times that, $30. For this life-saving medicine. So my hope is, as we talk here for the next 12 minutes and 2 seconds, I'll explain how data is actually the solution, and it's not just more manufacturing, and it's not just more policy. So the first thing that needs to be done is you need to understand what the medicine is, what the requirement is. As these clinics get their data and they digitize and they're actually able to understand the patients that they have, what the needs are, and the demand for medicine, you can then anonymize this data and work very closely with the insulin manufacturers, with governments. And when you can bring these stakeholders together, you can actually make a huge impact. If you're a large company that makes a life-saving medicine, your goal is to sell more medicine. Heck, anyone that runs a business, your goal is to make more money. And that's a fine goal. But in the healthcare space, it takes a little different tone. You need to do good in order to do well. And I think for me, having lived and operated in China for 10 years, in Thailand for 2.5, sometimes people forget this, and especially in the healthcare space, you need to take a different approach. So in emerging markets, the goal, I believe, should be to do good, to do well. And what that means for insulin is you need to understand where your users are. You need to be able to work with governments and with these clinics to bring the medicine, not just from 1 or 2 manufacturers, but from 10 to 20, because simple supply and demand, when you have more medicine, the price goes down. When you have a large population of diabetics and a large population of insulin users, and half of these today, half of all insulin users today don't have access. So let's put this in business terms. That means if you're an insulin manufacturer, you have an untapped market of 103 million users. And the average spend per year is 40% of their income. So look at whatever market you're in. It's a very large business opportunity, and the long-term value is there. But from a humanity perspective, typically what is happening is you get a couple of companies that dominate a market, and you don't get as much competition. And my hope is with the leaders and shapers in a room such as this, in an exciting market such as Pakistan, hopefully we can take that 50% and lower it so more people have access to these medicines. And the clinics as well, they play an important part. So I asked ChatGPT what it would describe, how it would visualize a government sandbox. Does anyone here work in healthcare or in government? I see a few gentlemen. All right. So a sandbox policy is a very interesting concept. And in healthcare, you have to work with government because healthcare is a fundamental and yet very sensitive market. So what we've successfully been able to do in Southeast Asian markets is we work very closely with the clinics to help them understand what their patients are, what their patients require, what new products they can offer. We work very closely with government then. We create a sandbox policy. And the incentive is do good, do well. This will bring in new revenue streams and new tax streams, but we have to make sure that the end patient, that number, that 206 million, let's make sure that they get served. So as DALL-E or ChatGPT visualized, this is what the future of a sandbox looks like. So you have a bunch of stakeholders. You have manufacturers, you have doctors, you have government officials, all trying to look at that central. What is it that we can do to improve health? And ultimately, that means you need to make sure it's cheaper and faster to bring a product into market. And this is where data is king. If you're able to help a manufacturer of a medicine enter a market with clarity, and what I mean is, here is the reimbursement rate from the public insurance. Here are the steps you must do in order to receive public versus private insurance reimbursement. That changes the game. If you make very clear, here's how you can access and analyze our public institutional records and use it so that we, the population of country X, Pakistan or wherever, is able to benefit from this as an outcome. It makes a significant difference. And doctors typically become a physician because they feel a calling. I come from a long line of doctors, and I can truly say it's a vocation. You either have that call to help or you don't. And when you have that, it's the only thing you want. You really want to do what's best for your patients. You want to help as many people as you can. And on my journey, I initially thought I was supposed to be a doctor. But as I explored and learned, I realized a physician can help one patient at a time. And so over my decade in China, I had an identity crisis. And I tried to figure out what's the best way that I can help as many people. And being a white boy from the Midwest who speaks fluent Mandarin, I learned over time that I can actually work with governments and healthcare companies and a healthcare system. And instead of helping one person at a time, if I can help one state or one government, we're not talking about 10 people, we're talking about hundreds of thousands, and depending on the country, hundreds of millions. This is what excites me about this picture so much. And I realize it's an abstraction because it's not easy to visualize what a government policy looks like. But I think this does a very good job. And the idea is trying to make sure that everyone is included, right? That's why it is almost like a Knights of the Round Table. Everyone's around and is talking and trying to learn how they can share. So to recap, the medicine is very important. You need to make sure that the data is safe, that the patients understand what's happening with their data, and that you have the government aligning. You must have these stakeholders aligned. And the goal ultimately should be the patient, the clinic, and the manufacturer. They have real-time data directly from hospitals and directly from these software companies, because this is the only way we can make improvements. Currently today, an average company that wants to enter a new market will spend 6 to 12 months. They'll spend $100,000 just to learn about what the market opportunity is. And you know what? They'll get about 10% of usable insights. With a solution like this, they get actual understanding inside of a clinic. They know who the doctors are. They know what the patient's current prognosis is and how they're changing over time. With that, they can actually bring their medicine to people who need it most. You can begin to think about the incentives that these pharma companies can offer, these medical device companies can offer. They can provide it at cost, subsidize it to the hospital. And again, from a business case, you can make a clear logic as to how you can extract long-term value. But if you don't enter the market, if you don't have primary data, if you don't know what's happening, which is currently the case, you're flying blind. Again, I had, I think, 24 hours to put slides together, so apologies, these aren't more perfect. The old versus the new. And if you really go into a smaller, less developed part of Pakistan, the left image is exactly apt. You'll have handwritten records, and you'll have notes that are disorganized, and you'll have a company like AstraZeneca or a company like Novartis that has life-saving treatments that they want to bring to the patients in that clinic. But because the records are not digitized, they're not organized, the data is not structured, they don't know where their users are. You can call this whatever you like. You can call it an ad tech, you can call it a med tech. At the end of the day, what I'm proposing is that data, not the ad tech, the ed tech, the data itself is the solution. And I think each of these stakeholders has a very important role to play in it. So going from left to right, old to new, from manual to digital, I think that is where Pakistan is on the cusp of. I yesterday received news, a dear friend of mine from Balochistan, who's currently in Karachi, just became a father. And hopefully today I can visit him in the hospital. And I know he's at one of the very nice, fancy hospitals. But last night, when he sent me his wife's record, it was still old. In one of the better private hospitals here in Karachi, a lot of these solutions are still manual. So my hope is clinics, as I said, leaders in the healthcare and the pharma space will listen and try to learn more about how data can work on this. And if my clicker will work, wonderful. Again, the goal is to have these three stakeholders, the hospitals, clinics themselves, working with government in the middle, and all of the manufacturers on the other ends. And the goal is to have newer products and services for the patients, better access to markets for the manufacturers, and cheaper products for everyone. If you spend all of this time and money just to learn where your users are, and you get a 10% return on investment, you're going to charge a lot of money. If, however, you know where your users are, you can be very targeted, and you can have lean teams that bring your product to market. So with that, I would like to say thank you very much to the organizers. You have 2 minutes and 10 seconds if you would like to go grab a tea or a coffee, and I appreciate your patience. Thank you very much.